Hey everybody, this is Shannon, the Iron Nurse Practitioner, and you may have heard this term from the iron deficiency blogs, but what is hypophosphatemia? Let's take a look. Okay, so let's talk about what you probably heard online from some of the iron deficiency blogs, which is a decrease in phosphorus after an IV iron infusion. So first of all, what it's thought to do, it was particular irons that was originally thought, which is monoferric or Ferrinject, which is a UK brand, which is ferric carboxymaltose. They thought that these particular brands were the ones responsible for excreting more phosphorus in the urine, but now they actually believe that it's more related to somebody that has deficiencies in vitamin D, calcium, or has high thyroid levels, or parathyroid levels, sorry. And they also link it to excessive alcohol intake or a malabsorption issues like in gastric bypass, a Roux-en-Y procedure, things like that. So it's not necessarily considered anymore just a type of iron and maybe some vitamin or mineral deficiencies. And what those symptoms can look like after an IV iron infusion is because phosphorus, which is an electrolyte, is responsible for muscle contraction, then muscle weakness is a big one, cramping, another one, and then fatigue and malaise is a big one, which is like that general feeling of unwellness. Or I like to say it's like a truck, it feels like a truck hit you and you just really can't, it's hard to get out of bed. Irritability, confusion, appetite loss, even some bone pain, and maybe even numbness, depending on the severity of these symptoms. Now, what's documented in any kind of studies is very mild hypophosphatemia, but this can be, and the reason I'm talking about it is that this can be why you don't feel better after getting an IV iron infusion. So if you know that you have low vitamin D or calcium levels, you may want to preload before your IV iron infusion, and then certainly add phosphorus containing foods after or before and after your infusion for a few days, just to make sure that you don't experience these symptoms and that your IV iron is the best it can be with the least amount of side effects.